Thank you everyone for coming today. We're happy to be here to welcome Senator Blumenthal and Aisha Clark from Health Equity Solutions to discuss the issue of medical debt in Connecticut and across the country. I am Kathleen Holt. I am the healthcare advocate for the state of Connecticut, and I have a state agency of individuals who help people resolve disputes with insurance companies and their providers. We hear from thousands of healthcare consumers every year as we work with them, and we're reminded daily that most of us are one car accident, one cancer diagnosis, one house fire, one chronic disease away from crushing medical debt. People tell us about the stress and fear of medical debt because it is unplanned, unpredictable, unavoidable, and unaffordable. One study showed 72% of medical debt comes from acute care hospitalizations, usually just one stay. But medical debt adds insult to injury when it's included in credit reports. Why? Because it is often inaccurate, it doesn't represent a person's bill payment history, and people lose cars, homes, jobs, and their lives become even more unstable. More vulnerable people are disproportionately harmed by medical debt. The problem of medical debt has become so severe that last July, Connecticut prohibited medical debt reporting by hospitals and collection agencies to credit agencies. This past January, the federal government acted to follow suit, but last month, a court decision recommended by the Consumer Financial Protection Bureau reinstated medical debt as reportable to credit agencies. Now, there are some questions about whether Connecticut medical debt reporting is inconsistent with the Federal Fair Credit Reporting Act, regulating debt collector and hospital reporting to credit agencies. But at the very least, we know that medical debt will worsen with challenges facing Medicaid and the Affordable Care Act plans, increased healthcare costs, and increased out-of-pocket responsibilities for Connecticut consumers, including delayed care. Currently, the cost of delayed care is about 38% in addition to what people are already paying. So what can consumers do? We have 3 suggestions. Minimize medical debt by making sure that insurance pays when it should. Contact our attorneys and our paralegals, our nurses, and our consumer information representatives at the Office of the Healthcare Advocate to make sure your insurance is correctly paying when you need it to pay. Always go to the closest emergency room in an emergency, but otherwise use resources to identify free or discounted health care. Each hospital has a different assistance policy, but within the next few months, the Office of the Healthcare Advocate will launch a new resource with a list of all Connecticut hospitals, their assistance websites, and direct contacts to help healthcare consumers find and determine financial assistance. And by next July, we hope to launch a tool that will help people determine eligibility for free or discounted care to further compare hospitals. And finally, ask hospitals for help. Some people say to us, well, we're too proud to ask for charity care. But remember that hospitals are licensed as charitable organizations, and nonprofit hospitals do not pay taxes. And by not paying taxes, it is a substitute for that charitable care. In other words, when hospitals don't pay for property, income, or sales taxes, in exchange, they must provide community benefit. For instance, if you make minimum wage in Connecticut, some hospitals will qualify you for free care. And some hospitals offer discounted care for people who make up to $80,000 or a household of two that makes $116,000. We're all in this together. Those who need care, those who provide health care, and those who pay for health care. Medical debt should not bring more challenges than it already does. Our thanks to Health Equity Solutions for their leadership in highlighting the devastation of medical debt, to the Office of Health Strategy and the Connecticut Hospital Association for colleaguing and partnering, to the state legislature for supporting the creation of more resources to reduce medical debt. And finally, and most importantly, to Senator Blumenthal for being everywhere all at once and tirelessly leading the state and the country to seek solutions for all inequities, including medical debt. Thank you.
Thank you.
Thank you.
Well, thank you to Kathleen Holt for her advocacy as the healthcare advocate. Thank you to Alicia Clark for being here today and all the great work that she does at Health Equity Solutions as executive director there. I want to begin where Kathleen ended. What should be done? Very simply, the Medical Debt Relief Act that I have proposed, along with colleagues in the United States Senate, would prohibit credit reporting agencies from including medical debt on their credit reports. As Kathleen said so well, medical debt is enormously widespread. 280,000 people in the state of Connecticut have medical debt in the range of hundreds of millions of dollars. Nationwide, that figure is about 15 million Americans who have medical debt. And the number there is in the billions. A lot of Americans are one paycheck away from financial disaster, a car crash, or a medical incident can cause financial ruin. And the impact is not only immediate on their household finances, it's also potentially long-standing, because once medical debt is reported, it can stay on the credit report, or its impact can be on the credit report for years and years, which inhibits people from buying a new car or house or a lot of other investments where credit is necessary. And a bad credit report can really hurt people. The Medical Debt Relief Act would protect people, not give them a free pass from the debt, but just make sure that they are, in effect, protected against credit reporting that handicaps and straitjackets their financial status for years and years. Now, Connecticut's taken a strong step in the right direction. It's one of 14 states that prohibits the reporting of medical debt, although it is medical debt only to the healthcare provider. So anyone who pays with a credit card still can be reported to the credit reporting agency as that debt is reported by the credit card company or the institution that sponsors the credit card. So it is limited, and as Kathleen said very correctly, there is some question whether any of these state laws could withstand challenge in the courts, because they may conflict with federal law, and federal law always prevails, preempts state law. So any inconsistency between the state law and the federal law dooms the state law. And that's why we need a federal law. And finally, this problem is only going to burgeon because of the big, blatant betrayal, not the big beautiful bill. It isn't beautiful at all, and it is a betrayal that recently Republicans passed by a partisan majority in the Senate and the House. It's Trump's big beautiful bill. It's our blatant betrayal, meaning consumers were betrayed. Medical debt holders will suffer because it includes reductions in Medicaid and other kinds of constraints on insurance coverage, which will mean less of their medical costs are covered. And that means more debt. Very simply, the constraints imposed by the big beautiful bill are going to mean bigger debt for more people as a result of medical costs. That spells crisis. Medical debt crisis for millions of Americans who will see credit reporting agencies, in effect, condemn them to low scores on their reports when they try to advance themselves with a new house, a new car, or other kinds of investments. And potentially, even though it's not supposed to be reported, new jobs. So I'm grateful to the advocates who are here today, and please introduce Alicia Clark.
Thank you, Senator. Thank you for having us here. So imagine checking your mailbox, and instead of a bill of thousands of dollars in hospital fees, you find your debt is gone. For some in Connecticut families, that moment has already happened and come. As shared, my name is Aisha Clark, and I am the Executive Director for Health Equity Solutions. We are a statewide advocacy organization really focusing on advancing health equity through anti-racist policies and practices. And we worked with many partners throughout the state of Connecticut to ensure that medical debt is not put on the credit basis. And also we worked with this office here to ensure that there will be a streamlined process for hospitals to report their financial assistance programs. These are things that we need to have in our state to ensure individuals are not receiving bills when they otherwise could afford financial assistance. I'm honored to stand with you all today on an issue that weighs heavily in Connecticut and throughout our nation. Mounting medical debt and the real danger of that HR 1 poses with our collective progress. Consider this as shared, 280,000 adults in Connecticut carry medical debt. And across the US, about 1 in 12 adults are saddled with medical debt and medical bills. That's just not numbers, it's missed rent, it's postponed prescriptions, skipped meals. That's why Connecticut has stepped in and continue to step in. In December, our state launched the first wave of which planned to have $650 million debt elimination effort. We wiped out about $30 million in medical debt for about 23,000 residents using ARPA funds to do this. Most recently, over 100,000 more people were being notified of $100 million in debt canceled, made possible through state investment. We've even banned providers from reporting this debt to credit agencies, preventing it from damaging people's financial futures. These aren't compassionate gestures, they're life-changing efforts and policies. Still, this is not a cure-all, but it is an opportunity for hope. This brings me to HR 1, the blatant betrayal as shared. On the surface, it includes provisions like extending telehealth, HSA safe harbors, which sound helpful. But underneath, it slashes Medicaid and ACA funding by hundreds of billions of dollars, shifts enforcement burdens to states, and projected to push about 8.6 million more Americans onto uninsured polls. For Connecticut, this threatens to roll back our inroads. It undercuts employer-sponsored coverage, increases out-of-pocket expenses and costs, and deepens medical debt once more. HR 1, if not addressed and or if not passing the bill that our senator has shared, we risk unveiling the safety net that we've carefully knitted here in our home state. Gains we've made could be lost and will be lost, and more families could face that dreadful choice of treatment and or financial survival. That's why now is the time to act. It's important to keep our Connecticut's medical debt relief efforts in place, pushing to scale state investments, expand eligibility, and keep shield laws firmly in place. We can't do this alone. Our senator cannot do this alone. So it's important for our congressional delegation to really support the medical debt relief policy that's put in place, and also cuts that will weaken our marketplace protections in Medicaid. And instead invest in robust and working safe health policies. And to everyone else who's listening, you have the power. Call your Congress, stand up for policies that protect coverage, and that roll it back. Spread the word, share your stories, and join us in urging our lawmakers to safeguard healthcare access for every Connecticut families. Thank you.